How to heal an ankle sprain forever. This is your 5-step plan. Welcome, I'm Dr. Po Raval, over 35 years in practice as a podiatric physician. Podiatrists see ankle sprains more than any other specialty, so go to a podiatrist. So step number 1, proper diagnosis. Let's look at how complicated this joint is. First, you have the retinaculum, which holds all the tendons to the front of the foot. It extends to the outer ankle, it extends to the inner ankle, which means a bad sprain may tear both sides and can also tear the retinaculum. On the outer ankle, which is the most sprained part of the ankle, you have tendons called the peroneal tendons. Peroneal tendonitis, extremely common in ankle sprains, and the peroneal tendons here insert into the outer foot as well as the bottom of the foot. So this is usually what people complain about because the peroneal tendons will pull every time you walk. So proper diagnosis, delineate the tendons. Number 2, a proper diagnostic tool, which means you need to be properly evaluated, not evaluate yourself and base it on what you feel. You need to go to a podiatrist and see which tendons are affected. After that, your podiatrist may send you for X-ray, MRI. An MRI if there's a suspected tear of the tendon, and X-ray if suspected fracture. Okay, so 2 diagnostic tools. Step number 3, you have to address an ankle sprain, not based on symptoms, but what is actually happening. So you need to put on a brace, and a fairly snug brace to control swelling, and you need some level of a boot. The 2 boots. This is a post-op surgical boot. It has a little bit of a bend, a rocker bottom, so it does all the work. That's for a low fracture, usually the foot. A higher fracture, we put everybody into a cast boot, which looks like this. It's fairly light, by the way. So that is your next step, your 3rd step. The 4th step is it always takes 4 weeks for an ankle sprain. Whether you feel great or not, whether it swells or not, you need to give your tendon time to heal. And the biggest mistake people make is they say, I feel great. They take everything off after 2 weeks, never see their doctor, and become chronic ankle sprainers. 4 weeks is the minimum. Go back to your doctor. After 4 weeks, the 5th step, or 5th step, is you always should be dispensed some level of an insole or custom orthotic. If you already wear them, even better, because you want to stop that ankle sprain from happening again. So you need to be in a good support system. And if there is any swelling or pain left, I usually send people for physical therapy. Remember, physical therapy also is 3 days a week for 4 weeks. You're trying to heal a tendon so that it never happens again. So those are your 5 steps: proper diagnosis, proper testing, immobilization, go back into an orthotic or insole, and possible physical therapy. Don't be a chronic ankle sprainer.